Are you unknowingly putting your heart at risk with the medications sitting in your medicine cabinet right now? Today, we are going to reveal 6 commonly prescribed drugs that could be secretly threatening your cardiovascular health. This information could be life-changing. So, if you care about protecting your heart, make sure to subscribe to Balance Health and ring the notification bell to stay informed about crucial health insights that could save your life. When it comes to hormonal contraceptives, millions of women rely on these medications for family planning. But what many do not realize is the hidden cardiovascular danger lurking within these seemingly harmless pills. Combined hormonal contraceptives, which contain both estrogen and progestin, come in various forms including pills, patches, and vaginal rings. Research reveals a shocking truth that these contraceptives can dramatically increase your risk of heart attacks and strokes. A groundbreaking study following over 2 million Danish women between ages 15 and 49 discovered that women using estrogen-progestin combination pills face double the risk of arterial blood clots. The numbers are staggering, with 1 additional stroke occurring for every 4,760 women and 1 extra heart attack for every 10,000 women each year. What makes this even more alarming is that non-oral forms like vaginal rings showed nearly 4 times higher heart attack risk. The dangerous mechanism behind this increased risk involves estrogen disrupting your body's natural blood clotting system. Estrogen enhances the production of clotting factors, creating a dangerous environment where blood clots can form more easily. This risk becomes particularly frightening for women who smoke, have high blood pressure, or elevated cholesterol levels. Fortunately, progestin-only contraceptives present significantly lower cardiovascular risks, with progestin-only IUDs showing no increased risk of heart attacks or strokes. Moving on to medications you probably have in your medicine cabinet right now. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are among the most frequently used over-the-counter medications worldwide. These include familiar names like ibuprofen and naproxen that people reach for whenever they experience pain, inflammation, or fever. However, what most people do not know is that these seemingly innocent pain relievers can significantly increase your risk of heart attacks and strokes. NSAIDs work by blocking cyclooxygenase enzymes, specifically COX-1 and COX-2, which are responsible for producing prostaglandins that control inflammation and various bodily functions. When these enzymes are inhibited, it creates a dangerous imbalance in your cardiovascular system, affecting blood vessel constriction and platelet function. This imbalance can lead to blood clots forming more easily, especially in people who already have heart problems. The Food and Drug Administration has issued serious warnings about NSAID risks, emphasizing that heart attack or stroke danger can begin within the first few weeks of use. The risk increases with longer usage periods and higher doses, affecting both prescription and over-the-counter versions. Not all NSAIDs carry equal risk levels though. Diclofenac has been linked to higher rates of major cardiovascular events, while naproxen appears to have a more favorable safety profile among this drug class. Diabetes medications, particularly thiazolidinediones like rosiglitazone, represent another category of drugs with concerning cardiovascular implications. While these medications effectively control blood sugar levels in people with type 2 diabetes by improving insulin sensitivity, they come with significant heart-related risks that many patients remain unaware of. Rosiglitazone functions by activating specific receptors that influence genes controlling glucose and fat metabolism. While this mechanism successfully lowers blood sugar, it also affects fluid balance and cholesterol levels in ways that can harm cardiovascular health. A controversial meta-analysis published in the prestigious New England Journal of Medicine revealed a 43% increase in heart attack risk among rosiglitazone users. Multiple research studies have consistently demonstrated that rosiglitazone significantly increases heart failure risk. While some studies show mixed results regarding stroke and overall mortality risks, the heart failure connection remains undeniable. This controversy has led to increased scrutiny of all diabetes medications and emphasizes why doctors must carefully weigh blood sugar benefits against potential heart risks when prescribing these drugs. Antidepressants, while crucial for mental health treatment, also carry cardiovascular risks that deserve serious consideration. Tricyclic antidepressants, such as amitriptyline and nortriptyline, work by preventing the reabsorption of mood-regulating neurotransmitters like norepinephrine and serotonin. However, their mechanism of action affects heart function in potentially dangerous ways. These medications can cause dramatic blood pressure drops when standing up, leading to dizziness and increased fall risk due to their effects on adrenergic receptors. They can also disrupt normal heart rhythm by prolonging electrical conduction through cardiac tissue, visible as changes in electrocardiogram readings. These rhythm disturbances can predispose patients to serious arrhythmias, including ventricular tachycardia and fibrillation. Additionally, tricyclic antidepressants often cause rapid heartbeat due to their anticholinergic effects, which becomes particularly problematic for people with existing heart conditions.
Selective serotonin specifically targets serotonin reabsorption and generally present lower cardiovascular risks compared to tricyclic antidepressants. However, certain SSRIs, particularly can cause dose-dependent changes in heart rhythm that increase the risk of a rare but potentially fatal arrhythmia called Torsades. The FDA has responded by recommending maximum daily dose limits for. Finally, pseudoephedrine poses cardiovascular risks that many people completely overlook. This decongestant effectively relieves nasal congestion by stimulating alpha, causing blood vessel constriction in nasal passages. Unfortunately, this constriction effect extends throughout the entire body, potentially impacting heart and blood vessel function. Pseudoephedrine can elevate both blood pressure and heart rate due to its widespread blood vessel constricting properties. Research has shown that even in people with well-controlled high blood pressure, pseudoephedrine can cause modest but concerning increases in systolic blood pressure. There have been documented reports linking pseudoephedrine use to acute heart attacks. As the drug's stimulating effects increase the heart's oxygen demands, potentially triggering cardiac events in susceptible individuals. The medication can also induce dangerous heart rhythm abnormalities, including rapid heartbeat, which becomes particularly concerning for people with underlying heart conditions or those taking other heart-affecting medications. People with existing cardiovascular problems such as high blood pressure or irregular heart rhythms should consult their healthcare providers before using any medications containing. Understanding these medication risks empowers you to make informed decisions about your health. Always discuss potential cardiovascular effects with your healthcare provider, especially if you have existing heart conditions or risk factors. Remember that knowledge is your best defense against hidden health dangers. If this information opened your eyes to medication risks you are not aware of, show your appreciation by hitting the like button. Share your thoughts, questions, or suggest topics for future videos in the comments below. We genuinely value your input and engagement. Do not forget to subscribe to Balanced Health and activate notifications so you never miss our essential health insights. Stay informed, stay healthy, and we will see you in our next video.